A middle aged man, diabetic, presented to me with a history of bleeding in the urine since the last 8 months. We did an ultrasound which showed a 2.5 centimeter growth in the bladder or tumor in the bladder. So we planned for TURBT, which is basically a scarless microsurgery done through high definition camera and underwater high current. So this is the tumor you can appreciate, and the instrument you are witnessing here is actually a loop device which is cutting the bladder tumor into piecemeal. The objective always is to completely cut the tumor. This is a wake up call for all the people who are watching this video, that if you encounter or you come across any patient telling you that there is bleeding in the urine with or without any history of smoking, he or she should be properly evaluated. One of the commonest questions asked to me by patients with bladder tumor is, so why me? Lots of speculations have been proposed, but one of them, which carries the most weightage, is smoking. There are others, for example, people working in rubber factories, plastic factories, paint factories, patient with exposure to arsenic in the water. But in most of the cases, the cause remains a mystery. As you can see, we are meticulously resecting the tumor. Usually, the admission time or the admission duration is less than 24 hours. We operate in the afternoon or in the morning, and we discharge the next day morning. So, usually, it is less than 24 hours. It is a painless procedure for the patient. We catheterize the patient overnight. We remove the catheter the next morning, and once the patient voids satisfactorily, we discharge the patient. Sometimes few bleeders can obscure the vision, so it is important that we have a proper vision while operating. So cutting as well as closing or coagulating the vessels at the same time is equally important. We have almost completely resected or cut the tumor. Maybe last 10 to 15% of the tumor is still left to be resected. We have reached the bed of the urinary bladder. These are the places where we encounter the most blood vessels, and it is also easy to control these blood vessels. You can see the bleeders. You can see the bleeding. Is always advisable to take control of the bleeding because it obscures the vision. See, the bleeding has been controlled and we complete the remaining resection. The next step is to take a deep muscle biopsy just to ensure whether the deep muscle has been involved by this tumor. Complete resection has been performed. This is the cold cup biopsy. We squeeze the muscle, we tear it apart, and we send it separately in another container. This is the final hemostasis or final look at the resection site and taking control of any bleeders, coagulating the margins. We have come to the end of the surgery. Thank you so much for watching the video.